Hi everyone. In this video, I am going to discuss regarding application of Roy's adaptation model in a patient with colostomy. So there was an earlier video where I had already posted about application of Roy's adaptation model in a patient with heart failure. So in this video, quickly we will see how the same model can be applied in various modes for a patient with colostomy. So as we all know, Roy's adaptation model, it mainly talks about adaptation in various modes, okay, that is starting from the physiological physical modes till the interdependence mode. So it is not only for a patient with colostomy, it can be applied for any patient who is trying to cope up due to illness. Okay, it can be due to some social interaction problems related. In such cases, also you can use Roy's adaptation model. Even a patient who is admitted in an intensive care unit trying to adapt physiologically, okay, for that patient you can apply. Some cases like where amputation or say paraplegia or even colostomy, in all these cases you can use Roy's adaptation model because we know this model fully it talks about how a person have to adjust to the various roles of sickness. Okay, so we know that the nursing process, when I'm going to apply Roy's adaptation model, it is something, it's quite different from our ordinary nursing process in one or two ways. So what is the difference? The main thing is it is a six-step nursing process. That is, it has two assessments. One is assessing the behavior, second is assessing the stimuli. Okay, usually in nursing process, we write only one assessment column, whereas when you use Roy's adaptation model, we have to draw two columns. One is for assessing the behavior, second is for assessing the stimuli. The third is going to be nursing diagnosis, the fourth is goal setting. So that all is as usual. Okay, after assessment comes nursing diagnosis, then comes objective or goal setting. Next is plan of action and intervention, and the last one is evaluation. Okay, so this is a six-step nursing process which is being recommended by Sister Callista Roy. Now coming on to each column, quickly we'll see what you should write in each column. Now the first one is assessment of behavior, where you have to collect both the subjective and the objective data. And according to Roy, whatever behavior comes from the patient is because of it is an effect of a stimuli. There are certain stimuli which is coming and affecting, and because of that, the defense mechanism is activated and the patient is responding as behavior. So, to be more clear, we have to assess the subjective behavior, the objective behavior, and you have to write the adaptive mode in the assessment column. Okay, so assessment of behavior, in assessment of behavior, you will have to write the subjective behavior, the objective behavior, and the adaptive mode. Now, coming on to assessment of stimuli. What should I write in assessment of stimuli? Stimuli, according to Roy, is it can be either an external stimuli or it can be an internal stimuli. Okay, so any stimuli can be there for a particular patient, but according to Roy, again, the most important thing what we should remember is focal stimuli, contextual stimuli, and the residual stimuli. Now, what is a focal stimuli? Any stimuli which is immediately causing a particular behavior is called as focal stimuli. Now, for example, if when I administer an injection to a child, okay, the child is crying. Okay, the child cries. The crying is a behavior. Okay, but why is the child crying? Because of the pain due to the injection. So the focal stimuli will be the pain due to the what is the reason for that behavior of pain? It is because of the prick of the needle, the prick of the injection. That is going to be the focal stimuli. In other words, it is the immediate stimuli which is causing a particular behavior. Now, according to Roy, there is something other than that which is called as contextual stimuli. Now, what may be the contextual stimuli? Now, when I take this child to a particular treatment room and then I'm going to administer the injection there, okay, either in an injection room or in a treatment room, I close the door and I make sure that the parents are away from the child. Now, if this is going to be the situation, that when the parents are not there and when the door is being shut and nurses are going to be like strangers for this particular child, maybe that itself leads to that crying behavior of the child. I hope you agree with me. That is called as contextual stimuli. Contextual stimuli are all the other stimuli which can lead to a particular behavior. So Roy believed that there is a focal stimuli, there is a contextual stimuli, and there is something called as a residual stimuli. Now, residual stimuli is a stimuli about which not much data is there and it is not very clear, but I feel that may have an effect on behavior. Now, again, coming on to this particular example. Now, this particular child is, say, a toddler or he is a preschooler. Maybe age has an effect on that particular behavior. Now, the same thing when I take an adolescent into a particular room and give an injection, maybe that this much of crying will not be there which is being expressed by an adolescent, okay, but still there are exceptions. But certain stimuli, the direct effect is not very clear, but still it may have an effect on the behavior. So according to Roy, we have focal stimuli, contextual stimuli, and residual stimuli. So when you're doing a nursing assessment, we will have to find out what may be the focal, contextual, or residual stimuli. Now, coming on to the next column is nursing diagnosis. So, when we write nursing diagnosis according to Roy, you have to write the statement of the behavior followed by the most relevant stimuli. Okay, so usually how we write in Anda's nursing diagnosis is you write the diagnostic label related to factors. Here, when you write, you can write the diagnostic label, that is a statement of the behavior related to the stimuli. So, whatever you have written in stimuli, that should come in the nursing diagnosis column related to factors. So we'll see that in this example of colostomy. Next is goal setting. Again, the speciality when you use Roy's adaptation model is when you're going to write the goal setting, three things should be evident in goal setting. What are they? The behavior change expected. So maybe he expresses reduction in pain. Okay, so that is the behavior change expected. What to say, expresses reduction in pain, okay, or he maintains optimum nutritional status as evidenced by. So the second word what you should write in objective is as evidenced by. As evidenced by, maybe weight gain is there, as evidenced by patients appears relaxed, as evidenced by verbalization. So that should be written. The third thing what you should write in Roy's adaptation model is the time frame, within 1 hour or within 2 days or within 1 week. So you will have to write the time frame. So these are the specialities which stand out in a Royce adaptation model. That is, number one, assessment, you have two columns. Nursing diagnosis, you have to write the diagnostic label with the stimuli, related to the stimuli. Goal setting, whenever you write, it should be a three-part statement. The expected behavioral change as evidenced by time frame. Now, the next one is intervention. So there is not much changes in Roy's adaptation model. Only thing is your intervention should be focused either to remove that particular stimuli or to encourage a particular stimuli which gives a positive adaptation, or to minimize the occurrence of the particular stimuli. So practically speaking, when you write a care plan, there is not much change in the plan of action and the implementation. It is usually the same thing. Next is the last one, evaluation. Evaluation is you are going to determine the degree to which the behavioral changes has occurred after a particular group of intervention is called as evaluation. Now let us look this, okay, in with respect to four modes. Okay, so in Roy's adaptation model, she has talked about four modes. Adaptation can happen in physiological physical mode. There may be problems of adjustment in the self concept mode. Maybe there are problems in role function mode or in interdependence mode, because each mode there is a tendency that when a patient becomes sick, when a person becomes sick, or when a person becomes ill, there is a chance that adaptation may be affected in four modes. So that is how beautifully Roy has thought about all the modes, still that role function and interdependence mode, how a nurse can play a great role in bringing back the adaptation. Now let us see this scenario. A case scenario, we are going to discuss about a patient who is 35 years old. She was found to diagnose. She was diagnosed with CA colon, and her biopsy report revealed that she is suffering from invasive adenocarcinoma, and then she underwent a surgery and now she is on permanent colostomy. Now, let me tell you that I am meeting this patient during the post-operative period. Okay, so now this particular patient, Mrs. Y, is having permanent colostomy. Now, let us look into what are the various nursing diagnoses. Okay, at least one nursing diagnosis for each mode. So, the first mode, what I'm going to write here is the physiological physical mode. Why? Okay, what is a problem in this physiological physical mode? I find that Mrs. Y is verbalizing severe pain in the stoma side. Say it is on the second postoperative day, I am meeting this particular patient and I find that she's verbalizing that she's having severe pain. So on assessment, I found that the pain score is found to be 6. On a VAS, I found that the patient is reporting a pain score of 6, and I also observed that she's guarding the abdominal area and she's appearing restless. So these are the behavior what I found in Mrs. Y. That is, she's verbalizing her pain score, she guards the abdominal area. Now, coming on to assessment of stimuli, what may be the reason why this patient is suffering from pain? Number one, it can be due to disruption of the skin due to surgical incision. That is the reason for pain because she has undergone a surgery, the skin is disrupted. Number two, presence of colostomy. Maybe that particular stoma itself is ending up with severe pain. Again, second postoperative day, maybe that is a contextual stimuli because as the days are, advancing, the patient's pain may get reduced. So second postoperative day, I also find that the patient is trying to sit for a prolonged period of time. So it is said that patients with colostomy, when you are going to sit for a long period of time in the initial phase, that itself can result in pain. Okay, so prolonged sitting, okay, maybe that is another one contextual stimuli. And the residual stimuli, what I identified is patient is anxious. I know that anxiety definitely is not the cause of pain, but anxiety may increase the perception of pain. So that is why, you think about all these things. The first thing what you write is the immediate cause. What may be the cause? It is due to disruption of skin integrity. Patient is having colostomy. Second post-operative day, contextual stimuli. Maybe she is sitting for a long period of time. Maybe she is anxious. That can be the residual stimuli. So this is how you identify the assessment of behavior, assessment of stimuli. Next is you have to write the nursing diagnosis. So how should we write? Write the nursing diagnosis. Acute pain related to. What should I write in related to factors? All the stimuli. What are the stimuli? These things. Disruption of skin, presence of colostomy, second postoperative day, continuous sitting, anxiety. So the diagnostic label should be followed by the stimuli. That is one of the specific thing which we should remember in Roy's adaptation model. Now coming on to goal setting, I know I have to write a three-part nursing. It's not a nursing diagnosis. Three-part goal setting should be written. So how am I written here? She expresses reduction in pain as evidenced by verbalization or pain score is 0 and appears relaxed within 1 hour, say on 23/7/2021. Okay, so the three parts have come. The expected behavior changes, she is experiencing less pain, as evidenced by verbalization, pain score appearing relaxed within 1 hour. Then all your plan of action and implementation as usual to reduce the pain. Encourage her to verbalize, actively listen, avoid prolonged sitting, administer analgesics, assist with range of motion exercises, encourage relaxation techniques, provide diversional activities. So these are the various interventions I am planning to do. Actually speaking, please make sure that you're having one more column here. Due to the space constraints, I have put it plan of action and implementation. How you have to write a student's plan of action should be in a separate column. The next column should be implementation. So please note that here you should have actually a 7 columns should be there. Okay, now here only 6 is there. 7 should be there if you are planning to write plan of action and implementation, especially for your exam. Okay, now coming on to evaluation, nothing much, no, not much difference. She verbalized reduction in pain. Pain score is reduced to 1. She appears calm and relax. So that is how you write the care plan for physiological physical mode. Now let us look into the next mode, self-concept group identity mode. Now, we know that already in my previous video, I have explained in detail that self-concept according to Roy's adaptation has two self. You remember that one is personal self and another one is physical self. Physical self is related to body sensation, it is related to body image, okay, that self-esteem, etc. Now, coming on to personal self is a higher level one. Personal self is physiology, it is a more of psychological thing. Like, for example, self-concept disturbance, feeling powerlessness, anxiety, hopelessness, all those things comes under personal self. Now what I have put it in this example of colostomy is physical self. So what is that physical self? It is body image disturbance. So this patient is 35 years old and she's what Mrs. Y is verbalizing negative feelings about bodily changes due to that colostomy, and she does not look at the stoma side and she refuses to participate in care. So she is not that happy to look into the stoma site because she has certain negative feelings. And what is the stimuli? What may be the reason for this negative feelings about bodily change? Maybe it is due to presence of colostomy. It can be due to disease process because she is suffering from cancer and associated treatment. Experiencing cancer, experiencing the treatment of cancer, sure, there will be lot of body changes. Okay, especially if this particular patient has already undergone chemo or say radiation therapy, then definitely there will be body changes and she's not feeling good about herself. So the nursing diagnosis formulated is disturbed body image related to these are the stimuli. What are the stimuli from here? Presence of colostomy, disease process, associated treatment. I hope you got that clarity how we are writing the nursing diagnosis in Roy's adaptation model. Coming on to goal setting, she is using new coping strategies to enhance her perception about body image as evidenced by verbalization of feeling confident, participating in care within 2 days. So that three part has come. The change in behavior as evidenced by time frame. Now coming on to plan of action and implementation, all nursing interventions to improve body image should be carried out. What is that? Encourage in self-care, assure that all these feelings are normal, assist in identifying coping strategies, help her to prepare to do own stoma care to become more independent. Now, what is the evaluation? She expressed that she feels more confident related to handling of stoma and she participates in care, which means that she has slowly adjusted to that bodily changes due to colostomy. So that is how we write the second mode, that is the self-concept group identity mode. Now coming on to the third mode, okay. So the main thing what I admire in Sister Callista Roy is how nicely this theorist has looked into the adaptation not only of physiological and psychological, but even the changes which can happen in role. We all need adaptation, especially when we suffer from a particular small sickness or an illness. So, what is the role function mode for Mrs. Y? Mrs. Y verbalizes dissatisfaction with sick role. She is not happy to be sick. No, none of us are happy to be sick, but she is having a lot of dissatisfaction with the sick role. What may be the reason? Because she expresses that she is not able to help her husband and her children, and she's also having a lot of tiredness and fatigue. So maybe that tiredness itself may lead into a dissatisfaction with the sick role. So the nursing diagnosis is role dissatisfaction related to inability to help. That is a stimuli. Inability to help one's spouse and children, tiredness or fatigue secondary to disease process and its treatment. Coming on to goal setting, patient and caregivers will develop realistic goals for independence and satisfaction in the role as evidenced by verbalization within 2 days. So, some nursing interventions are being planned not only with the patient but also with the family so that they experience realistically, they will identify what roles they have to play, and the patient can be helped to overcome that dissatisfaction. So, the plan of action is this: encourage her to express her perception of roles, okay, address the inadequacies, reinforce what are her strengths, realistically negotiate the role responsibilities, share her experience with the family, allow for family time, allow for family support. Now, what is the evaluation? She expressed satisfaction with her role and she explored means to control. Now coming on to the last mode is interdependence mode. We know interdependence mode, Roy gave more importance for relationship. Okay, like getting interaction with our own family members, maybe it is with our friends, okay, with the society. That is interdependence mode. Now, according to Mrs. Y, she verbalizes less contact with friends and relatives, and always she appears sad because she's not, because of colostomy, she's not so happy to call up her family members or relatives or friends, and she always appears sad. Now, let me tell you, other than this particular, so if you're going to see the nursing diagnosis, it is social interaction. Other than social interaction, you can write about ineffective family coping, ineffective individual coping. All these nursing diagnoses you can write under interdependence mode. Okay, now what may be the reason why is she not contacting with her friends and relatives? Maybe because she's having loss of control of body functions with ostomy, because she's getting adapted to that new particular ostomy, and she's not very happy in controlling that particular ostomy. And only when she learns to gain that control over ostomy, she may feel a little bit free to call her friends and family. Maybe that is the stimuli. Maybe she's not so self-concept is affected. Maybe it is due to that chronic illness. She's appearing very sad and she's not contacting her family and friends. So the nursing diagnosis formulated was impaired social interaction related to concern. It's the same thing: loss of body function, self-concept, chronic illness. Goal setting: she will participate in interaction, social interaction, as evidenced by communication with family and friends within 5 to 7 days. Now, what is a plan of action? Explore her feelings, allow her to participate in group interaction, 10 minutes at least for each. During each nursing intervention, spending at least 10 minutes extra, so that it helps to build a relationship with the nurse, involve the client and her family. Okay, now the evaluation is she's sharing quality time, she communicates with her family, she appears relaxed. Okay, so this is how we what to say use Roy's adaptation model for a patient with colostomy. So to put it in a nutshell, when you are applying Roy's adaptation model, when you write a care plan for a patient with Roy's adaptation model, think about the four modes. Okay, what are the problems faced by this patient in physiological physical mode? What may be the problems this patient is experiencing in psychological or self concept or body image, personal, spiritual self? Okay, that self concept, group identity mode. What may be the problems the patient experiences in role? Is she happy with the role? Is there any role transitions which has taken place in the family? Give importance to that. Last but not the least, give importance to the relationship aspect. Is my patient happy with the relationship she's having with her family, with her friends? Okay, is she maintaining that good social interaction? Whether the relationships between the family is okay, is she comfortable with that? Okay, so these are the various aspects which Callista Roy, Sister Callista Roy, wants us to think about when you take care of a patient. Because once you look into all the four aspects, beautifully you check whether comprehensively adaptation is achieved by the patient. You can apply this model to any patient who wants to adapt either physiologically or self, personal physical self, or any problem with roles or any problem with interdependence or relationships. Okay, so it's such a nice thing to write Roy's adaptation model, and I'm pretty sure that you will be able to apply this care plan for your exam. Because Roy's adaptation model, there are differences when you write a care plan. The what to say, the way you write the assessment of behavior, stimuli, formulating the diagnosis with stimuli, writing the three-part objective statement of behavior as evidenced by with time frame, then the implementation and the evaluation, the degree to which it has attained. Perfectly, you can apply Roy's adaptation model in nursing process. So I hope and I sincerely pray that this video will be useful to all students who are learning to apply Roy's adaptation model while giving nursing care. So this theory teaches us to think not only about the physical aspect, not only about the psychological aspect, but a step ahead to look into their role function aspect, a step ahead to look into whether my patient is satisfied with all the relationship aspect. So it's a wonderful theory which we can write even for your practical exams while you're doing your post graduation. So thank you very much for all your great support, love, and encouragement. Thank you.